8 weird skin signs of kidney damage you must not ignore. Your kidneys might be failing, and your skin could be the first to know. That's not a scare tactic. It's a medical reality. We often dismiss a persistent itch as just dry air, a new rash as an allergy, or puffy ankles as the result of a long day on our feet. But what if these weren't just minor annoyances? What if they were distress signals from one of your body's most vital, yet overlooked, organ systems? Kidney disease is a silent epidemic. The World Health Organization estimates that over 800 million people worldwide live with chronic kidney disease, or CKD. The most terrifying part is that up to 90% of them have no idea. This is because the disease often progresses without a single obvious symptom until it reaches its late stages, by which point the damage can be severe and irreversible. Every single day, your 2 fist-sized kidneys work as the ultimate filtration plant for your body. They tirelessly process about 45 gallons of blood, meticulously removing waste products, balancing your body's fluids, regulating blood pressure, and producing hormones essential for red blood cell production and bone health. They are unsung heroes working silently in the background. But when they start to struggle, that finely tuned system breaks down. Waste products like urea and excess phosphorus begin to build up in your bloodstream. Doctors call this condition uremia, and it's like a city sanitation system going on strike. Trash piles up everywhere, and eventually, the whole system becomes toxic. This is where your skin comes in. By the time these 8 weird signs appear on your body's largest organ, your kidneys have likely been in trouble for a while. This message is especially critical if you belong to a high-risk group. Pay close attention if you are over 50, have diabetes, struggle with high blood pressure or obesity, or have a family history of kidney failure. Your body is trying to communicate with you, and this guide will help you understand its language. Everything you are about to hear has been fact-checked and is based on established medical science, designed to empower you with knowledge, not to fill you with fear. Let's decode the messages your skin might be sending. The 8 skin signs of kidney damage. First, the unscratchable, maddening itch. Imagine it's 2 o'clock in the morning and you're wide awake, not from a noise, not from a bad dream, but from an itch so deep and persistent it feels like insects are crawling just beneath your skin. You scratch until your skin is raw, but the relief is fleeting, and the itch returns with a vengeance. This isn't your typical dry skin itch. Doctors call this condition uremic pruritus, or chronic kidney disease-associated pruritus. It happens because when your kidneys fail to filter waste, toxins like urea and excess phosphorus build up in your blood. These substances can travel throughout your body and irritate the nerve endings in your skin, triggering a systemic, body-wide itch that no amount of surface cream can fix. It's an internal problem screaming for attention on the outside. It often starts as a minor annoyance, perhaps just on your back or arms, but over time it can become generalized and relentless, severely impacting your sleep, your mental health, and your entire quality of life. The constant scratching breaks the skin, which can lead to bleeding, permanent scarring, and dangerous secondary infections. If you have an itch that is widespread, seems to get worse at night, and doesn't improve with standard moisturizers, it's a major red flag. In fact, studies show that up to 40% of patients on dialysis experience this debilitating symptom. Don't just dismiss it. Second, the persistent puffiness. Let's try a little test. Press your thumb firmly into your shin for a few seconds. Now lift it. Do you see a small indentation, like a pit, that remains for a moment before slowly filling back in? Maybe you've noticed your rings feel tighter, your shoes pinch by the end of the day, or you wake up with a puffy face that takes hours to subside. This is a classic sign called edema. Healthy kidneys are masters of fluid balance, expertly removing excess sodium and water from your body. When their function declines, they can no longer keep up. Salt causes your body to retain water, and this excess fluid has to go somewhere. Gravity naturally pulls it down into your legs, ankles, and feet. It can also accumulate in your hands and around your eyes, especially after you've been lying down all night. What starts as slight ankle swelling can progress to severe, constant puffiness that makes walking difficult. The skin over these swollen areas becomes stretched and fragile, making it prone to breaking down and forming slow-healing ulcers that can get infected. In very serious cases, this fluid can even build up in the lungs, causing shortness of breath, a condition called pulmonary edema, which is a medical emergency. If your skin pits when you press on it, or if swelling is sudden and accompanied by chest pain, you need to seek medical attention right away. Third, the unnatural skin color changes. You look in the mirror, and the person staring at you seems off. There might be a pale, almost washed-out quality to your complexion. Or perhaps you notice a yellowish, grayish, or even an earthy brown tint that no amount of sleep can fix. In some very advanced cases, a person might even notice a white powdery substance on their skin after they sweat. These changes are due to a trifecta of effects from kidney failure. The paleness is often caused by anemia. Healthy kidneys produce a hormone that tells your body to make red blood cells. When kidneys fail, you make less red blood cells, and the lack of them literally drains the color from your skin. The yellowish or grayish hue, sometimes called a uremic hue, comes from the buildup of waste products called urochromes, which get deposited in the skin. And that rare white powdery residue, that's called uremic frost. It happens in end-stage kidney disease when the concentration of urea in the blood is so high that it actually crystallizes on the skin as sweat evaporates. While uremic frost is very rare today thanks to modern dialysis, the paleness from anemia and the sallow skin tone are common warnings that your body's internal chemistry is dangerously off balance.
Fourth, skin as dry as a desert. Your skin feels tight, rough, and scaly, almost like fine sandpaper. It flakes and cracks easily, especially on your shins, back, and arms. No matter how much lotion you slather on, the dryness persists, sometimes leading to painful cracks or fissures that can even bleed. The medical term for this is xerosis, and in kidney disease, it's profound. Chronic kidney disease can cause the sweat and oil glands in your skin to shrink and become underactive. Without the natural moisturizing and protective barrier from sweat and oil, your skin loses water rapidly and becomes severely dehydrated from the inside out. What begins as simple dryness can worsen into a condition that looks like fish scales. These deep cracks and fissures are more than just uncomfortable. They are open doors for bacteria, significantly increasing your risk of skin infections. This intense dryness also makes the maddening itch of uremic pruritus even worse, creating a vicious cycle of itching, scratching, and skin damage. If your dry skin is extreme and relentless, it's a sign the problem is systemic, not just skin deep. Fifth, bizarre, itchy bumps and sores. Out of nowhere, you might develop small, firm bumps on your skin, often in clusters on your legs or torso. They are intensely itchy, and over time, a central crusty plug or scale forms. If you pick at them, they leave behind tiny crater-like scars. This strange and distressing condition is called acquired perforating dermatosis, and it's strongly linked to chronic kidney disease and diabetes. While doctors are still studying the exact cause, a leading theory is that waste products, like damaged collagen fibers, build up in the skin. Your body recognizes these as foreign invaders and tries to expel them by literally pushing them up and out through the skin surface, perforating it from the inside out. These lesions are notoriously itchy and can lead to significant scarring and discoloration long after they heal. It's estimated that about 10% of patients on dialysis develop this condition. The appearance of any new, persistent, and intensely itchy bumps, especially if you have risk factors for kidney disease, should be evaluated by a doctor. Sixth, unexplained blisters. Imagine finding large, tense blisters on your hands, feet, or other areas of skin that see the sun. They didn't come from a burn or from friction. They seem to appear spontaneously. When they finally heal, they often leave behind fragile skin and scars. This condition is sometimes called bullous dermatosis of hemodialysis. It's a significant sign seen in patients with end-stage renal disease. Your kidneys are responsible for clearing certain light-sensitive compounds called porphyrins from your blood. When the kidneys fail, these compounds accumulate. When you're exposed to sunlight, these compounds react and create damage in the skin, causing its layers to separate and fill with fluid, forming a blister. These blisters can be painful and may rupture easily, creating open wounds that are highly susceptible to infection. Any blistering that isn't caused by an obvious injury is a serious medical sign that demands a prompt evaluation by a doctor. Seventh, painful lumps and ulcers. Now we come to the most severe and dangerous skin sign of all. It often starts as a small, extremely painful, purplish or reddish mottled area of skin that looks like a deep bruise. This area soon hardens into a deep, agonizing lump. Then, over days or weeks, it breaks down into a non-healing, black-crusted ulcer. The medical name is calciphylaxis, and it's a rare but catastrophic condition. In advanced kidney disease, the body's balance of calcium and phosphate is completely destroyed. This causes calcium to deposit in the tiny blood vessels of the skin and fat, blocking them off, like sediment in a clogged drain. Starved of blood and oxygen, the tissue dies, leading to these horrific gangrene-like ulcers. The pain is often described as excruciating and completely out of proportion to how the lesion looks at first. This is a true medical emergency. If you develop a new, intensely painful, hard lump under your skin that becomes discolored, go to the emergency room immediately, especially if you are a known kidney patient. Calciphylaxis has a very high mortality rate, and early, aggressive treatment is the only chance to save the tissue and your life.
8. Troubled hair and nails. Finally, take a look at your hands. You might notice your nails look strange. A classic sign is what doctors call Lindsay's nails, or half-and-half nails, where the bottom half is white and opaque, while the top half is a normal pink or reddish-brown. You might also see white bands running across your nails, known as Merkey's lines. At the same time, you might find that your hair is thinning, dry, brittle, and falling out more than usual. Your hair and nails are a direct reflection of your nutritional status and overall health. The severe metabolic stress, protein deficiencies, and anemia that are common in chronic kidney disease can completely disrupt the normal growth of hair and nail cells. While these changes can have many causes, they are important pieces of the puzzle. When seen in conjunction with any of the other signs we've discussed, they strengthen the case that a serious, systemic problem like kidney disease is at play. When to seek help. Seeing one of these signs doesn't automatically mean your kidneys are failing, but it absolutely means you need to find out what's going on. Some situations are more urgent than others. If you experience any sign of calciphylaxis, those painful, hard lumps turning into black ulcers, or have sudden, severe swelling, especially with shortness of breath, this is an emergency. Go to the ER or call your doctor immediately. For more gradual symptoms like a persistent itch, worsening dry skin, new rashes, or changes in your skin, hair, and nail color, you should schedule an appointment with your doctor soon. Start with your primary care physician. They can perform simple but crucial blood and urine tests to check your kidney function. From there, they may refer you to a kidney specialist, called a nephrologist, or a skin specialist, a dermatologist, management and prevention. If you are diagnosed with chronic kidney disease, managing these skin issues is a core part of managing the disease itself. Your doctor will guide you, but the approach often starts with diet. Working with a dietitian to create a kidney-friendly plan, often limiting sodium, phosphorus, and potassium, is crucial. Hydration is also key, but it must be tailored to you. While some people need to drink more water, patients on dialysis may need to restrict their fluid intake. Your daily skincare routine also becomes a form of medicine. Use thick, fragrance-free moisturizers every day, especially after bathing.
Choose short, lukewarm showers over hot baths that strip the skin of its natural oils. And protect your skin from the sun. Finally, lifestyle adjustments and medical adherence are non-negotiable. If you smoke, you must quit, limit alcohol, and stick to your prescribed medications, which might include phosphate binders or treatments for anemia. Regular checkups are your best tool for tracking your health and intervening early. Your body is talking. Are you listening? Your skin is more than a protective barrier. It's a billboard for your internal health. These 8 signs are not just cosmetic issues. They are profound distress signals from an organ system that is struggling to keep you alive. The good news is that with kidney disease, early detection dramatically improves outcomes. Catching it in the early stages allows you and your doctor to take steps to slow its progression, manage your symptoms, and preserve your quality of life for years to come. Don't ignore the whispers before they become screams. That persistent itch, those puffy ankles, that change in your complexion, they are your body's way of talking to you. The only question is, are you ready to listen? If this information was helpful, please give this video a like and subscribe for more vital health content.
Please share this video with anyone you know who has diabetes or high blood pressure. It could save a life.